Hello, friends. Welcome back to LinkMed. Today, we will start with the infectious disease cycle. We will learn about the main or the most common infectious diseases in children. The most common infectious diseases like chickenpox, common cold, flu or influenza, hand, foot, and mouth disease, strep throat. In children, like for chickenpox, the cause is varicella zoster virus. Etiology, like it is very highly contagious and spreads through respiratory droplets. Common cold, caused by various viruses. Example, rhinovirus, one of the most common. Etiology, common cold, type of respiratory problem. So the etiology is same as spreads through respiratory droplets. Flu or influenza, it is caused by influenza virus A and B types. Etiology, it is also a type of respiratory problem, airborne transmission. Hand, foot, and mouth disease, caused by enteroviruses, like mainly Coxsackie virus A16, like fecal, oral, or respiratory transmission. Strep throat, caused by Streptococcus bacteria. And it is usually group A, Streptococcus. Etiology: spread through respiratory droplets. Now shortly we will also know about some symptoms, signs and symptoms. In varicella zoster, we will see some itchy rash, fever. In common cold, we will see runny nose, cough, sneezing. In flu, we will see symptoms of fever, muscle ache, and some respiratory symptoms too. What can be the respiratory symptoms? In flu, we will have it can be like nasal congestions and breathing problems too. Some symptoms we will see in hand, foot, and mouth disease. In enterovirus, we will see some symptoms like fever, sores on hands, feet, and in the mouth. Now here strep throat will have some common symptoms like sore throat, fever also. This is not a full list of common infectious disease in children, but most common, we can say, most common type of infectious diseases in children. Now from here we will focus on some respiratory infections. Then we will also do some other type of infections. So let's move on to some common type of infections. Those are respiratory related. Respiratory infectious diseases. Croup, bronchitis or bronchiolitis, pneumonia, whooping cough, now we will do from croup to whooping cough. Croup, it is infectious disease usually caused by virus. So it is a viral infection. Caused by like para-influenza virus. And etiology, same like respiratory droplets. and some symptoms. We'll do it all together one by one, like barking cough, barking cough, stridor. Next, we do bronchiolitis, caused by respiratory syncytial virus. Etiology: respiratory droplets. Symptoms: wheezing and difficulty breathing. Next, pneumonia. It can be caused by bacterial infections like most common streptococcus pneumoniae or viral infections. You know the other viral infections that can cause respiratory problems. Like what can be the symptoms of pneumonia? The most common symptoms like cough, rapid breathing, you have problem with breathing, and fever. Whooping cough, which is also known as pertussis. Whooping cough is caused by Bordetella, pertussis, which is a bacteria. Etiology: same, we are reading about respiratory infections. So, etiology will be airborne transmission. Some symptoms: the name itself is telling you about cough. So, in symptoms, we will have severe cough, and that is also called like spells. Severe cough or spells, where you will hear some whooping sound. This is the common symptom for whooping cough. Skin diseases in children. Again, we will learn about the most common skin diseases. Eczema, which is also called as atopic dermatitis. Etiology. This can be like genetic and environmental. Factors. Symptoms. Itchy red and inflamed skin. Next, impetigo. Caused by Staphylococcus aureus or Streptococcus pyogenes. Bacteria. Symptoms. Red sores, blisters, or cluster lesions. Ringworm, also known as tinea infections. Etiology. Fungal infection of various species. When we talk about symptoms, if you have ringworm infections, so what can be the symptoms? You will have some circular, red, and scaly type of rash. Next, in children, we have diaper dermatitis, also known as diaper rash. Etiology, if we talk about diaper dermatitis, then it will be irritation from wet diapers. Those can cause some frictions or fungal infections. It's very necessary to take care of this wet diapers. So symptoms is red irritated skin, in the diaper area. Next, molluscum contagiosum. Etiology. Pox virus, small dome shaped, pearly skin colored papules. Scabies. Etiology. Sarcoptes scabi. Mite. Sarcoptes scabi mite infestations. Symptoms: intense itching, small red bumps, burrows, hives, also known as urticaria. Etiology: allergic reactions or infections. What will be the symptoms? Symptoms will be raised itchy welts on the skin, hand, foot, and mouth disease. We have already done, we can skip this. Next, chicken pox. We have already done, we can skip this. Last but not the least, we have a disease named fifth disease, erythema infectiosum. Etiology: parvovirus. B19. Symptoms: slapped cheeks, or slapped cheek rash, we can say, and fever. These are most common skin conditions in children, but it's important also to understand its etiology, its symptoms, and this infectious disease cycle. We did some infectious diseases, those were related to the children, where we have most common type of infectious diseases like chickenpox, common cold, flu, hand, foot, and mouth disease, and strep throat. Those were most common type of infectious diseases. Among those, if we talk about infectious diseases, those are respiratory type. And then here also we have like common cold, influenza, croup, bronchiolitis, pneumonia, and whooping cough. And next we talk about most common skin diseases in children. So here we'll have like eczema, impetigo, ringworm, diaper dermatitis, molluscum, and also scabies. Those are like intense itching type of diseases with small red bumps, and hives that can be caused by some allergic reaction or infections, and hand, foot, and mouth disease. chickenpox, also fifth disease also known as erythema infectiosum. This is caused by parvovirus B19. So friends, keep learning. LinkMed. And we will also cover the other infectious diseases in next coming videos. Please keep watching and learning from LinkMed. Thank you very much. Hope to see you in the next video.